Hey everybody, what's up? Physical therapist Dr. Rant Whelton. My thoughts on residency programs and fellowships and all that stuff. My first thing I would like to say about that is that most new grads coming out of college say they feel lost. That's not good. It's not good for the public, and it's not good for those therapists. Now, I went to Northeastern University and we had the co-op program. So, which was really cool because, by the time I graduated from physical therapy school, I had already worked a year and a half in the clinic as basically like a PTA, not a licensed one, but that was essentially a role. We get to do rehab or whatever. So I felt much more experienced and like I knew what I was doing by the time I graduated. Now, most schools don't have that. But what you can do is I think that they should extend these rotations in the clinic so people feel more familiar with what they're doing. Now, having said that, okay, residency programs, fellowships, or whatever, I've always felt like an alien in my field, and the reason why is because all I focus on is results. That's all I care about. I don't care about, analyzing 57.5 years of quadruple blind studies or learning of how something works physiologically. Like, who cares? I got a patient on Monday that's suffering in pain. Half my patients in my clinic tell me they thought about killing themselves. What am I going to do? Tell them about my research? They don't care, They care about getting better. They care about results. And sometimes that gets lost and people get caught in the left brain analysis paralysis. But don't follow people in physical therapy, in the world of physical therapy online. I don't. It drives me crazy. And the reason why it drives me crazy is because no one's talking about results. We're talking about analysis, how to analyze. No more analyzing. Fix people, okay? Should you get your, go to a residency or fellowship? What are the results is it going to bring, okay? Is your clinical instructor a results-based therapist? Are they going to say to you, what is your percentage right now? Okay, so it looks like you're at 50%. 50% of your patients are getting better. 20% of your patients are getting out of pain immediately. What techniques, what treatments can you use to increase that number and help more people? It gets lost on people about what we're actually doing in the clinic, and people just start focusing on, I read the study, and let me tell my patient about it. Like, they don't care. They don't care. I'm telling you, they don't care. I have a clinic where everybody's failed everything. I don't take insurance. People expect something more from me when they come to me. I have to answer to the public for my clinical skills. And I believe that everybody should have to, okay? But, it's just the way it is. But should you do a residency or something like that, if you feel like you're going to get better results, physical, tangible outcomes, increase your percentages, okay? Then do it. But if it's going to be like, here's how to analyze data, right? Who cares? If you want to do that, go get a job as a professor, right? But if you're a clinical person and you're in the clinic all the time, fix these human beings, these poor people. I'm writing a paper on mechanical back pain. Over half the people told me they thought about killing themselves. And it drives me crazy. Every day I hear it. And I ask myself, why is this happening? Why is this happening? Why are these people getting missed? Why have they failed everything? They've seen physical therapists, they've seen chiropractors, they've had their spines fused, they've had countless injections. And the reason why is because people aren't focusing on what to do. They're focusing on how to think or analysis. Focus on what to do. You never forget the goal when you wanted to be a physical therapist to help people. Never forget that. And that gets lost on people as you get into the left brain analysis paralysis. Anyways, if you feel like you're going to get better results, do it. I got videos for free. I post them all the time. People say it's revolutionizing the results, okay? On YouTube, Whelton Methods, go. Listen,